Hi, this is Dr. Tam from Dentistry. We've been getting a lot of questions about dentures. So today, we're going to talk about dentures and hopefully answer some of the questions that you might have about them. Dentures is a term that we use to refer to an appliance that can be used to replace some teeth that are missing. Now, there's a lot of different kinds of dentures. They're usually classified by how many teeth they replace. Complete dentures will replace an entire arch of teeth, meaning all the bottom teeth or all the top teeth. Another kind of denture is a partial denture. Partial dentures will replace anywhere from 1 to, I'd say, probably a max of about 10 or 11 teeth. And the difference is that partial dentures will not replace all the teeth, but just replace some of the teeth, and then you'll also still have some of your natural teeth. The dentists that usually do dentures or make dentures are either general dentists or prosthodontists. A lot of general dentists do make dentures. Sometimes if a patient's particular situation or mouth is a little more complicated, then we will refer them to a prosthodontist, which is basically a specialist that will deal in just dentures or just bridges or some other dental procedures like that. Usually, a patient will need dentures or will recommend dentures when they're either missing a lot of teeth and they need teeth in order to chew or smile, or sometimes all of the teeth in their mouth are in really bad shape. Either they're broken or they're worn down or they're infected, and trying to save those teeth that are in a patient's mouth is either cost prohibitive or just not recommended because the overall prognosis of the teeth is not good. In those cases, a dentist might recommend that dentures are a better option for a person. Also, say somebody is missing a few teeth and they just need some teeth to replace those missing teeth and fill the spaces, and they don't want to do another procedure. A lot of times a denture will be a good option for them. So as we were saying before, dentures are used to replace teeth. We'll recommend that the patient potentially get dentures when they're missing either all or some of their teeth. Some other options for replacing teeth are bridges, which we've reviewed in some of the other videos. A bridge is basically a restoration where we'll put crowns on some teeth and they'll hold other crowns, and those will be used to replace the spaces or the missing teeth. Another option would be implants. Implants are another permanent option where an implant is placed into your jawbone and then the crown is attached to the implant. So both implants and bridges are some alternatives to dentures. So we've talked a lot about the different kinds of dentures, either complete or partial dentures. There are also another distinction that we can use to classify different kinds of dentures. One is a removable denture. That's exactly what it sounds like. This denture will be placed in the mouth and then can be taken out by you or by the dentist, usually on a regular basis, like at night before you go to sleep. Some dentures are fixed, meaning they're actually attached into the mouth and screwed in, usually to implants. In those cases, those dentures are fixed and are not easily removable. They can be removed if you absolutely need to, but it's a more complicated procedure that usually needs to be done by the dentist and can't be undertaken by the patient. So a removable denture is a denture that can be placed in the mouth by the patient and also removed by the patient. These kind of dentures will either be attached to other teeth and will grab onto the teeth by means of little clips or clasps. There are also full dentures that can be removed by the patients. These can either be implant supported or tissue supported. If it's a full tissue supported denture, on the top the denture is held into the mouth by suction, and that can be removed by the patient by just breaking the seal on the denture. There are also implant supported full dentures. Those dentures attach to the implants, but those can be removed also by the patient by simply unstapping the denture from the implants. You could also do complete denture on the lower arch. Generally, I don't recommend those simply because they're not quite as stable. The only way we like to do dentures on the bottom is by placing implants and then attaching them to the denture. In order to make a denture, we will use a denture lab to help us make the denture. A lot of times we'll take either pictures or molds here in the office. Then we'll send those to a dental lab, and then they will begin the process of fabricating the denture. It usually takes a couple of appointments to do that, but usually within a month and a half, the denture is ready for the patient to take home. So a lot of times we have to assess how the patient's mouth is first. First, we'll review non-implant supported dentures, just tissue supported dentures. If it's a full denture, we will assume that the teeth that were either infected or broken have been removed, and we're just dealing with the patient's mouth with no teeth. In those cases, we'll take impressions of the patient's mouth and then send them to the lab, and over the course of several appointments, the dental lab will make the denture that will fit in the patient's mouth. Sometimes patients have teeth that are really infected, but they don't want to have all their teeth taken out first. In those cases, we'll do what's called an immediate denture, which means that we'll take impressions of the patient's mouth with their teeth in their mouth, and then remove the teeth on the model, make a denture that's based on the model with the removed teeth, and then when the denture is ready, we can take out the teeth that are either sick or broken, and then put the denture in the patient's mouth. That's called an immediate denture. In cases where the denture is going to be implant supported, implants have to be placed first, and then molds will be taken so that the denture can be made to fit on the existing implants. If there's a denture that's going to be made that's a partial denture, which means there's still some teeth in the mouth that are going to be kept, again, molds will be made of the patient's mouth, and then the denture will be made to fit the existing teeth and grab onto them with clips or clasps. For the most part, getting dentures is not painful. Sometimes it's a little uncomfortable when the molds are taken just because it's a lot to deal with in the mouth. But in those cases, usually beyond that, it's not too uncomfortable. If there are extractions or implants involved, in those cases, we'll need to either numb up the area in order to place the implant or to extract the teeth. Like I was mentioning earlier, if implants are needed to be placed or teeth are needed to be extracted, we will use local anesthesia to numb the area so that it's not uncomfortable for you as a patient. We're either placing the implant or taking out the teeth. If you desire, we also have laughing gas and conscious sedation available for patients who have a little more fear or anxiety. Our goal is to have your dentures look and feel as close to your natural teeth as possible. That being said, they never quite feel just as good as natural teeth, but it's our goal to try to make them as close as possible. I try to tell my patients, for the most part, that dentures are not a replacement for your teeth. They're a replacement for no teeth. Meaning, if you have no teeth, then dentures are great. But if you have your existing natural teeth, you should expect that your dentures will help somewhat and be better than not having teeth at all, but they won't feel quite as good as your natural teeth. There usually is a little bit of a learning curve when trying to speak with dentures just because it's something new in your mouth. Sometimes people find that they'll lisp a little bit, or they might salivate or spit a little more until they get used to speaking and eating and moving with the dentures in their mouth. Our goal is to have your dentures be as stable and solid as possible. That being said, there are usually a little bit of adjustment and changes that need to be made when trying to eat with dentures versus eating with natural teeth. By and large, dentures are apt to move around a little bit more than your natural teeth than bridges or implants. So you should expect dentures to be quite as solid as a bridge or an implant or your natural teeth. So there's still a little bit of movement that occurs when chewing and eating, but it's definitely better than not having teeth at all. If it's a fixed denture, you pretty much need to brush around the denture just like you would your regular natural teeth, and also do your best to clean above it as best as you can. Mouthwash and warm salt water are good for doing that. If it's a removable denture, I recommend that you remove the dentures at least at bedtime and brush them inside and out. And then once a week, hopefully you can soak your dentures in a solution with a denture tablet. That'll help keep the denture smelling and tasting fresh, and it'll prevent the buildup of plaque and food and just bad odors from accumulating. One of the biggest things that you can do is to keep your mouth as clean and healthy as possible. If there are still natural teeth present, you want to brush and floss those teeth as best as you can. You also want to try and keep the denture as clean as you can. Sometimes people have a tendency to go to sleep with their dentures. Please don't do that. That just increases the chances that cavities will form and that your gums can develop sores or ulcers. So it's really important to take dentures out at least 8 to 10 hours a day, just to let your mouth and your gums rest. Well, if as people ask, how long will a denture last? A lot of it depends on use and how well you take care of them. We've had patients have dentures for 15 to 20 years. Other times people will need dentures replaced every 3 to 5 years. A lot of it just depends on how hard you are on them and how well you take care of them. Sometimes if dentures break or a tooth comes out or if a tooth breaks, they can be repaired. A lot of times we're able to send it into a lab or do a repair here in the office. In some cases, if the damage is too great, a new denture may need to be fabricated. A lot depends on how much work was needed to be done to your mouth before the denture was made. That would determine how long the recovery period will be. If teeth need to be extracted or implants need to be placed, a lot of times the recovery period is a little bit longer. But usually once people have dentures, within the first 4 to 6 weeks, they're usually decently able to get used to the denture being in their mouth. Thankfully, if you need dentures and you have insurance, usually the insurance will pay a portion of the cost of the denture. Usually the entire cost is not covered by insurance. The cost also depends on whether or not teeth need to be extracted or if your existing teeth, if you are keeping them, are in good condition. Sometimes crowns need to be done. Sometimes implants need to be placed if it's implant-supported dentistry. So the cost of the denture, when you look at all of the things that are necessary, can vary greatly. If it's just the denture by itself, the cost can be anywhere between $1,800 and $2,800. If the price includes either crowns or fillings or even implants, the price can go higher than that. If you feel like you need dentures, or if you feel like dentures are something that would be a good option for you, please call our office as soon as possible just so that we can talk about it. The best thing to do is to get a sense of what's going on in your mouth and then to just see if dentures are a good fit for you and your mouth. Thank you for listening. If you have any questions or if you feel like dentures are right for you, please don't hesitate to call our office at 916-285-9678 or go onto our website at www.crowndentistry.net. We're here to help. Thanks.